Welcome to week 2 of 14, how to reduce your risk of dementia. And week number 2 is all about your ears and your brain. Welcome to Talking with Docs. I'm Dr. Bradley.
I'm Dr. Paul Zalzal. And don't forget to buy our supplements. A long line of supplements.
Yeah, we don't have any supplements.
What?
Yeah, none.
Remember the supplement? The kale supplement that tastes like a suicide chicken wing?
Yeah.
Didn't we execute that?
I don't think it took off.
Okay.
Okay.
Thanks for joining us. Remember, this is Talking with Docs,
Yeah.
where we just talk about medical topics, and we started a series on dementia, and there's 14 episodes in this series. This is number 2.
Number 2.
And it is to do with hearing, how hearing is tied to dementia.
And it's arguably the most important one. Some studies have estimated that loss of hearing contributes to 9% of dementia risk.
It's definitely the largest modifiable risk factor for development of dementia. So
let's start at the beginning.
Yeah, so the idea is, and what we're going to talk about today is basically how is it tied to hearing loss? How is hearing loss tied to dementia? You know, how do we hear? How do we lose our hearing? How to prevent it? How to treat it?
Yeah.
So that basically real things that you can do at home to help prevent hearing loss and thereby prevent dementia.
And I think for you or your loved one.
Yeah.
So some younger people might be like, listen, I don't want to get dementia, or someone might say, well, listen, my parents are maybe showing some signs, of reduced hearing. These are some practical tips on what to do.
And even your liked ones, not necessarily your loved ones.
That's right. Okay. So age-related hearing loss is very, very common.
Mm-hmm. Extremely common.
Over 65, they estimate 1 in 3 people, and by age 75, 1 in 2 people are going to have some loss of their hearing.
Yeah, which is alarming,
yes.
Right? Almost, that makes you think, well, this is just part of aging then, isn't it? Is it a pathology or is it part of aging when it's that common? But it is actually a pathology.
Right, and people are like, well, why does, and I was asking the same question, why does it matter if I can't hear? Why is that going to lead to cognitive decline and reduced kind of functional capacity in our brains?
Exactly, that's the main question.
Yeah.
And the main reason is because when you lose your hearing, then you're less socially engaged.
Yeah.
You're processing less information, you're not talking to people, you're not interacting with people, and that isolation is linked to the development of dementia because you're not using your brain as much.
So less cognitive stimulation.
Less cognitive stimulation, but you got to be careful.
Yeah.
Because too much or overstimulation also has a negative effect.
Well, and this is the second kind of theory. It's called cognitive overload. So when you don't have the ability to hear properly, your brain actually has to work harder to try to hear those muffled sounds with their different frequencies. So parts of your brain that normally be used for more complex processing or memory features kind of get rerouted just to try to do the hearing part.
Right, so it's kind of like a baby bear thing. You don't want too much processing, but you don't want no processing.
Oh, like a Goldilocks.
Yeah.
Yeah, okay. I got
The
it.
baby bear, the Goldilocks one, that's just right.
Yeah, I think you're right.
The porridge.
Okay, so
I paid attention in preschool.
you should. No, I don't think you did. So now you know kind of the pathophysiology behind it, but let's talk a little bit about hearing itself. So the name of age-related hearing loss is something called presbycusis.
Yeah, if you think about hearing loss, there's 3 main types. There's sensory neuro hearing loss, there's conductive hearing loss, and there's the combination, mixed hearing loss.
Right, 3 types.
By far, the most common one is sensory neuro.
Right.
Of which that category, age-related hearing loss, is one of them.
Right, so we have these little hairs called stereocilia that are inside.
Your cilia.
Yeah, I knew that it's such low-hanging fruit.
That's where I hang. That's where I shop.
What's nice though is that with age-related hearing loss, the dad jokes, you'll actually maybe miss a couple of them and maybe not totally understand them, but even people that hear them don't understand them.
Right.
But these stereocilia, these little hairs that convert sound waves into nerve signals that then go to your brain and allow you to process and make decisions based on the sound.
Exactly. Remember, sound is just a wave in air, so the little hairs flop around with the waves, and the hair cells change that into a neural impulse, into a nerve signal, and that's what goes into your brain. So that.
And what happens as we age, sometimes the hairs bend and they can even break, and this leads to reduced hearing. So, and this is sometimes part of normal aging.
Yeah, just as an aside, do you think it's related to the hair on our head loss? Are we in trouble?
No,
we're in trouble.
I can't hear. Can't hear you. Okay, so that's kind of the age-related part.
Right.
But there are other ways that we can do damage to those cells.
Yeah, definitely. And probably one of the most common ways to do damage is just exposure to loud noises, right?
Yes.
That could be a loud work environment. That could be loud earbuds listening to loud music. That could be sitting beside Brad.
Don't say it.
How did you know?
I knew.
How did you know?
Because I talk loudly. Everybody says, why do you talk so loud?
You talk just right.
Yeah.
People just listen too hard.
That's right.
All right, so just really too much loud noise. That's what can damage your hearing.
Okay, so let's get back onto the dementia train. So how could someone know or recognize in themselves that they have a reduction in their hearing, or maybe in a loved one or a liked one that you're talking about? Maybe someone's having some trouble hearing. Are there any signs that we could identify that would?
Yeah, absolutely, and they're kind of logical signs. So if someone has trouble understanding you when you're speaking, if you have to repeat yourself often, you're watching TV and you got to crank the volume so loud, people come and say, "Why is the volume so loud?"
Right. If you have trouble hearing on the telephone, you feel like you're transitioning to more speakerphone rather than holding the phone there. And then if you're just becoming disengaged. We've talked about this before. You may notice that you say your grandpa, your grandma maybe isn't talking as much, not involved in the conversation. It's not just because they're annoyed by the topic. It's because maybe they can't hear, and then that effort, or even potentially some shame, saying, "I don't want to ask again. Can you repeat the question again?" So they withdraw, and this is really bad for your mental health.
Yes, and although you have to be careful, because as your partner may tell you, there's a difference between listening and hearing. Oftentimes you're hearing, but you're not listening. Right now. You're not listening. You're hearing, but you're not listening. That's a different thing. That's after the hearing, and that's a processing of the information. But hearing, those are some of the common signs that there may be an issue with your hearing.
Okay, so now you've noticed this in yourself or in someone else that you care about. What should you do?
Well, get tested.
Okay, so you can test your hearing?
You can test your hearing. An audiologist is a specialist who's trained to test hearing. They'll give you a frequency, a spectrum of sounds, and record the different levels at the different frequencies.
Okay, so if you've noticed that you have signs or symptoms, you should be tested right away. If you have a family history, or if you have known exposure to some of the dangers like loud noise at work, or if you're taking medications that increase your risk, you should be tested right away. If you have no symptoms, is there an age where we should start maybe doing hearing screening?
Yeah, typically they say over 50, you start getting your hearing tested. It's probably a reasonable approach. You mentioned something cool, medications. That might be a surprise to people. Why don't we go through a few of the medications that can cause actual hearing loss?
Okay. Yeah, so I'd say there's four main categories. So probably the first one is the aminoglycoside antibiotics, or gentamicin or tobramycin.
The class of antibiotics that are commonly used because they are very effective against certain bacteria, and sometimes the only medication we have for certain bacteria. However, like all medicine, like everything we do in medicine, there's a risk-benefit ratio. And the benefit is you get rid of the infection that you're treating. The risk is they can be ototoxic, or damaging to your hearing.
Number two is a chemotherapy agent called cisplatin. Very, very commonly used. And obviously, if you have cancer, this is an important medication that there's not a lot of other options. They use safer options sometimes. But if you have to use this has a known risk to your hearing.
Right. That's a risk-benefit ratio you're probably going to go for, because it'd be, if you have to choose hearing loss versus cancer, you're going to choose hearing loss.
Number three is medication for blood pressure and for your kidneys.
Yes, there are certain antihypertensive diuretics that can cause hearing loss.
One of the most common ones is furosemide, trade name Lasix. So a lot of people take this medication, can cause problems with your hearing.
Very common diuretic.
And the last one we use all the time.
Boy, this one is really surprising because it is available over the counter. Everybody uses it. Anti-inflammatory, non-steroidal anti-inflammatory medications can be ototoxic as well.
Okay, all right. So now you know about the medication. So when it comes to hearing loss, now you've had your testing and you know that you have a problem. And now you're like, well, listen, I don't want to get to the point where I've lost my hearing. Obviously, for the age-related side of things, there's not much that we can do. What about the noise-related hearing damage that middle-aged and younger people can experience? Is there an amount of noise that we know is safe or problematic?
Yeah, well, we talk about the decibel level. So, and it's basically 85 decibels for 8 hours straight, that can do it. And the decibel scale is a logarithmic scale.
Yeah, and 85 decibels can be like a lawnmower, a loud blender, some loud construction equipment or construction site, that kind of stuff.
Yeah. Then we talk about 100 decibel level. That's much shorter exposure to 100 decibels can do damage. And you had a cool rule with your earbuds, what to put your...
The 60-60 rule?
Right.
Yeah, I mean, it's not my rule, but I shared it. So they say that you should only ever use 60% of the maximum volume of any device that has a volume limit. And you should typically only do it for 60 minutes at a time. So listening for prolonged periods of time or at very, very high volumes increases the damage to these hair cells that we talked about. And what's interesting is they're kind of like a rubber band. So as you stretch a rubber band, if you stretch and then let it go, it bounces back. But if you listen for too much volume and for too long a period of time, it's like if you stretch that rubber band beyond its stretch capacity, then you let it go and its shape is totally deformed. And that's what happens to these hair cells. So they do have the ability to recover, but only if you give them breaks.
That's right. It's just like, for all our material scientists, it's just like leaving the elastic zone and going into the plastic zone, where you can't go back to your original shape.
The elastic zone and the plastic zone.
Right? So you may be saying, well, what about my noise canceling headphones?
Yeah.
Do they protect my hearing?
Yeah, so I'd say kind of.
Yeah. They do actually protect your hearing, but they have some limitations. So there's two types of ear protection you can use, right? The active noise canceling, those are like your Bose headphones used on the plane, or even your earbuds have.
Yeah.
Some of them do have noise canceling. And then there's the just passive noise protection, which is those big earmuffs you see that the guys who are landing, directing the planes wear, that kind of stuff. The active noise canceling works by just, it has a little microphone in it. It listens to the noise that you're listening to and then produces a noise in the opposite phase, a counter noise and opposite noise, so the waves cancel themselves out.
Yes.
So it works great for background noise. We got a picture of it here. I'll show you a picture right now of how these noise canceling, you can see there's a sound wave coming in, the headphones produce another sound wave that cancels it out. They work great for background noise, like a plane, like when you're on the plane and you hear all the noise on the plane.
Right.
However, they're not good for sudden noises like a gunshot or like an axe or any sort of loud spikes of noise because they can't process fast enough.
Did you say an axe?
Yeah, an axe.
Does axe make a lot of noise?
I would think an axe hitting a hard wood.
Okay. I like
That's
that.
the first thing that came to mind.
I like it, an axe. Okay.
Yeah. Do you ever chop wood?
Interestingly, with the ice storm, I haven't been chopping it. I have a chainsaw.
Did you wear headphones?
I did.
Protective?
100%
Right.
protective eyewear and earwear.
Right.
Yes.
Right.
There you go. Sorry.
Okay, Paul Bunyan.
Yeah.
So those sounds can't be stopped with the active noise canceling. You need those big passive noise canceling.
I think that's important to know. So for a last part of protection, so as a younger person or someone maybe that has kids, I'd say there's a couple other areas that we want to talk about just quickly. So recurrent ear infections are known to cause potentially permanent damage to your ear depending on how quickly they were treated and how often they happen. So as a parent, obviously you need to advocate for your child with your doctor about getting this treated. It doesn't always mean antibiotics. I think that's a really important separate video to talk about, but recurrent ear infections can play a role. Another thing is cleaning your ears. We actually have an ear cleaning video, and we all should probably reduce the temptation to put a Q-tip in your ear because A, it can damage your eardrum, and B, it can pack the wax even further. Our bodies have a way to kind of brush the wax on out of our ear. They are self-cleaning, so if it's smaller than your elbow, don't put it in your ear.
Yeah, it's tempting to do it. It's addictive to do it. It's like the cocaine of the ear, the Q-tip.
Okay.
It can be dangerous.
There you go. Okay, and then the last part is, if you have been identified to have a hearing problem, is there anything that you can do? So I'm 72 years old, I've lost a significant part of my hearing, I'm feeling like I'm not being socially engaged because I feel very self-conscious about it. Is there anything I can do?
Absolutely.
Okay.
There are a cornucopia of hearing aid options.
Okay.
Lots of different hearing aid options. They're getting better every year. They're getting less obvious. Some of them you can't even see. I mean, you've seen people wearing them. You're like, what's that? They're very subtle, very subtle. So definitely there's hearing options for you. There's some that are super expensive, some that aren't very expensive. And even now, some of the commercially available like earbuds and things like that can act as, they're headphones, and they also act as hearing aids too.
And getting a hearing aid is not going to reduce the dementia or cognitive decline that you've already experienced, but it has been shown to drastically reduce progression or prevent it or reduce the risk of it happening going forward.
Yeah, it's a pretty easy treatment.
It is. And to be honest, I had no idea. Like it just kind of wasn't intuitive to me thinking, well, just because you can't hear, why does that take your cognitive function away? But we can't overemphasize, this is probably the number one.
And the yin and the yang of it is, you may be misdiagnosed with dementia when really it is a hearing issue because of the lack of engagement, you don't know what's going on. It could be misdiagnosed as dementia when really just a hearing aid you need.
Now I know, if you have an experience with any of this, please share a comment. And if you like this video, please like it, subscribe to our channel, share it with someone that you know that would be interested, and check out our podcast.
Right, and remember, this is the most important modifiable risk factor for the development of dementia. So if you got it, modify it. And remember, you are in charge of your own health.
See you next time.